In this malpractice case, a patient filed a lawsuit against the insured after being diagnosed with malignant melanoma. Let's delve into the details. The patient, a 77-year-old retired flight attendant, sought treatment from the insured for a wound beneath her right second metatarsal head. She had a history of basal cell carcinoma and warts and complained of pain, burning, and soreness exacerbated by wearing high-heeled shoes. The insured diagnosed the condition as pressure ulceration or a post-surgical wound, considering the patient's foot biomechanics and prior treatments. Treatment included debridement of the wound, advising the patient to stop using prescribed creams and sanding the area, and recommending shoes with cushioning and arch support. The insured also prescribed silver hydrogel and referred the patient to a podiatrist for appropriate footwear. Follow-up visits showed slow healing, prompting instructions to refrain from high-heeled shoes and to wear tennis shoes with a dancer's pad. The patient later developed a larger wound after discontinuing the dancer's pad and engaging in long walks. Eventually, another physician diagnosed her with stage 3 malignant melanoma. The patient alleged that the insured failed to provide appropriate treatment, order diagnostic tests, diagnose her condition, and refer her to a specialist, resulting in more aggressive treatment and diminished life expectancy. The defense team, consisting of a podiatric physician, surgeon, and oncologist, reviewed the case. The podiatric expert believed the insured's treatment fell within the standard of care, considering the patient's foot structure and shoe preferences. The surgeon acknowledged the rarity of melanoma on the plantar surface of the foot, but felt a biopsy should have been performed. However, he couldn't conclusively say it would have altered the patient's outcome. The oncologist stated that while the insured initially assessed the lesion as a pressure ulceration, after a prolonged non-healing period, alternate causes should have been considered. Nevertheless, he couldn't definitively say the patient's outcome would have been different if diagnosed earlier. Due to concerns about inaccuracies in the insured's medical records and the sympathetic nature of the case, a settlement was reached prior to trial. Here are some risk management tips to consider. First, ensure your medical records are accurate and contain only relevant information for each visit. In this case, inaccuracies could have affected the insured's credibility. Second, when dealing with non-healing wounds, it may be prudent to consider performing a biopsy. Although not the standard of care, awareness of other potential causes could be crucial. Remember to prioritize accurate record keeping and comprehensive assessments to mitigate risks in your practice.